Hi, everyone. My name is Meredith Newman. I am a reporter here with the News Journal. I am joined by ACE reporter Brandon Holveck, my colleague, who has really been leading our coverage in terms of COVID-19 vaccinations. And so this morning, we're going to ask Brandon some questions, talk about his reporting. Just to start off with the disclaimer, there is no possible way we will be able to answer every single question that you all watching have. So I would advise you consult with your healthcare practitioner, the state's website, or our website at delawareonline.com for anything that we didn't tackle today. Brandon, let's start off with kind of the basics, even though the basics can seem really tricky and confusing. Can you talk about what phases we're currently in and who is in those phases? Like what kind of roles and people are applicable?
Absolutely. So Delaware first got the vaccine in mid-December and started with what it calls phase 1A. And the first group among that phase are frontline healthcare workers. And even if you want to narrow that down even more, the very first people to get the vaccine were frontline healthcare workers in the state's 6 major hospital systems. But also included in phase 1A are residents and staff of long-term care facilities who are being vaccinated through a federal program with CVS and Walgreens, as well as medical first responders. So think about people like EMS personnel and that sort of thing. That's phase 1A. And they had exclusive access to the vaccine from about mid-December to mid-January. And then the state moved into phase 1B, which opened up the vaccine recipient pool to a much larger group of people. Phase 1B includes everyone 65 and older, as well as a select group of essential workers. So the pool went from about 70,000 people in phase 1A to more than 200,000 people in phase 1B, and that's where Delaware is right now.
So before we talk about kind of the mess that I'm sure everyone heard about, read about, saw, experienced this weekend, I guess if you are someone who fits those categories that you described, what's the best way to sign up for a vaccine or find out when you can get one?
So there are a lot of different avenues, and it really depends on what type of person you are. So the biggest group right now receiving vaccines are people 65 and older. And the process for them starts with a website called vaccinerequest.delaware.gov, I believe, but double check in our reporting in the state's website for the exact URL. That's an online registration system where people 65 and older can sign up to be on a waiting list, and the state will pair you with an event relatively close to you. And those are often those big DMV vaccination events that we'll talk about. But you can also try to sign up for a vaccine through pharmacies. Walgreens, Walmart, a few other companies are partnering with the state to offer vaccines, although the availability of those right now is very limited. And another option for people in that group is to try to connect with a private primary care provider. Some, but not all of those are providing vaccines, as well as the hospital system. So Christiana Care, for instance, has a page on their website where people in phase 1A and phase 1B who have not yet received at least a first dose of the vaccine can request an appointment to go get one. And I've heard from people that that's a very efficient process. I've heard from people who have been able to connect with their local pharmacy. Walgreens, in particular, downstate, has had availability for people to go in and get a vaccine with a very short wait, if at all, compared to what you might have seen this past weekend at the DMV events. Although, again, we'll talk more about those. People in phase 1A might be able to connect more through their employer.
Right.
But again, there has been issues with that. So some of those options like pharmacies or the larger healthcare systems are also options for them if they're looking for, especially a first dose still, but also a second dose, they might be able to get it through those means. But again, there's not like a central way, right, for people to just say, I want a vaccine and please pair me with the easiest solution. There's kind of a lot of different ways that you can kind of go with this.
Right. And for on the state's website, they have I would describe a tentative schedule of when the next phases will kick in. I believe
Right.
the next one is those who have chronic health conditions, serious underlying health issues, and other types of essential workers. But that website, I did write it down. It's vaccinerequest.delaware.gov. Again, kind of that's one avenue, as Brandon described, of getting more information about how to get a vaccine. So let's talk about this weekend. So this weekend was the first weekend where folks 65 and older could get a vaccine. Can you describe what happened?
Sure. So there were 3 days, Friday, Saturday, Sunday, at the Delaware City and Georgetown DMVs. And that website you mentioned, several thousand people, I don't know the exact amount, but a lot of people used that website last week to sign up. And with limited supply right now, about 11,000 of those, several thousand people received an appointment for a 30-minute window to go to either location to get a vaccine. Friday, our reporter Izzy Hughes was there. It seemed to run pretty smooth. Sunday, same thing. Sunday was very smooth, to the state's credit. But Saturday was the day where there were very, very long lines, and we reported a lot of people left the lines. More than 300 people who had appointments at Saturday's events did not get vaccinated from phase 1B. There are several reasons why. Some people had waits as long as 4 or 5 hours on Saturday to get a vaccine. The first is that just a lot of people showed up. People in phase 1A who still need vaccine were told that they could just show up without an appointment. And a lot more people than what the state was expecting from that group showed up. Because if you go back a little bit in time, we're talking about 70,000 phase 1A healthcare workers. So for all of them to get 2 doses, that would be 140,000 doses administered. And to date, the state has administered 82,000. So there are still a lot of people in phase 1A who are looking for a second dose, and some still looking for a first dose. So a lot of those people showed up. There were also equipment issues because it was very cold outside that the state says it corrected before Sunday's event. And then there were also people in phase 1B who did not have an appointment that showed up. That slowed the process down a little bit a lot on Saturday, I should say. So that led to a lot of frustration, for sure, among people. To the state's credit, again, Sunday seemed to run much more smooth. At most, I heard an hour wait for vaccine on Sunday at the events. And they're having a similar event in Dover, I believe, this weekend for about 2,000 people. About 11,000 people were vaccinated this weekend, which certainly increases the percentage of vaccine used by Delaware, but not without a lot of confusion and frustration.
Right. And we should note that you, Hughes, Jeff Nyberg, were really on the scene talking to folks. I'm curious if there's any anecdotes that stick out to you, just in terms of stories that you've heard of people who are trying to get the vaccine that just represent how difficult and emotional this process is.
Absolutely. One that stands out to me is a woman named Dorothy Cutting that I wrote about earlier this week. She's 86. She lives in Wilmington by herself. And she didn't even get to the point of waiting in the 4 or 5 hour lines this weekend. She's had difficulty just navigating the online system that's required to get one of those appointments. She contacted me looking for help, but it's kind of difficult for me to say where in the stages you are, because I don't have access to that program. I can't see what she's looking at, but she's thinks she's waiting for an email that she hasn't yet received, but she doesn't use the computer. She's probably not watching this Facebook Live.
Right.
And it's really unfortunate that she's someone who has spent most of her time indoors over the last year. She's very anxious and scared of getting COVID-19 because she does have some pre-existing conditions that would increase her chance of a severe illness from it. And I gave her a few ways that she can try other avenues, but there's no guaranteed way to sort of get in line for this if you can't navigate that online system. Others who were at the event on Saturday, Jeff wrote about a couple in his story that waited in line for several hours and determined that they couldn't wait any longer. A lot of others who needed to use the bathroom, for instance, or needed food and water and weren't expecting to be in line that long. Remember, these are mostly people 65 and older. Many have pre-existing conditions, had to bail on their first chance to get a vaccine, and now kind of have to navigate this convoluted system again to try to get back in line.
It's just so heart-wrenching. And we should note that you guys are getting emails and emails and emails and phone calls just with people looking for reporters as any type of avenue for guidance. So just another plug about how important this coverage is. Let's talk about, before we move on to the next subject, is there any recommendation from the state about should people stay in the line if they face severe waits? Is that kind of the thinking? Like, you will get a vaccine if you wait in line and have an appointment. I'm curious if they've said anything in the day since regarding recommendations, because I'm sure there will still continue to be long wait times.
Well, they promised to get appointments for those who couldn't stay in line this weekend. Still kind of need to follow up over the next week or two with those people to see if they were able to get connected with those. As far as whether you should stay in line or bail, I haven't heard any specific guidance on that. Ideally, there wouldn't be any more waits of that length moving forward. So I think that is a priority, I know, of the state to ensure that doesn't happen again. And kind of looking forward, there will still be those mass vaccination events, but the state is working on having events in a little bit of a smaller size in different areas of the state. So for instance, this week on Tuesday, there was an event in Newcastle, I believe, at least Newcastle County. And there's an event later this weekend in Dover for about 750 people, which would be less than half of the people that they're calling for at these large DMV drive-through events.
I remember with you saying that, I remember a quote from a resident who, I think it was Delaware City she was talking about. She was like, Delaware City is like Alaska to me, like just in terms of like how far people are driving to get a vaccination and how it might be outside of their circle of where they usually travel to, specifically in these times. Let's look ahead. You wrote a story about kind of issues with the second dosage this week. Can you tell us a little bit about what those issues are in terms of people, kind of a pause on people getting a second dosage?
Yes. So the state has canceled second dose appointments scheduled around this time in early February for medical first responders who received the vaccine, if you do the math, 3 or 4 weeks before. So at the beginning of January. And those 11,000 people we talked about who were vaccinated this past weekend at DMV events, I have not heard from a single one who received a second dose appointment at the event right after they got the shot. That was the process that state and federal officials had talked about for several months going into this vaccine rollout. Was you would get the shot, you would get a card saying whether you got the Pfizer or Moderna vaccine, and you would get a date. This is the time that you need to get the second dose of the vaccine for it to be fully effective. The guidance that I heard from plenty of people, passed on from the people who were at the event, the volunteers of the event, was try to get a second dose any way you can. Check our website, check pharmacy websites. And so far, most, if not all people have been, most, I should say, there are some who have second appointment, but most people have been ineffective in getting a second appointment at Walgreens, or if you use the state's website for another drive-in vaccine event. There are some that are shown in February, I'm told, but you're not able to book that appointment for those second doses. And the state officials have talked about it this week, that their priority is not getting people second doses. Their priority is getting more people first doses.
Right. Because there is still some effectiveness in just having one dose. I feel like it's important to say that you can't crisscross between the two types of vaccines. If you get a Pfizer vaccine, you have to get the second one that's Pfizer, and same with Moderna. So that's important for people to know. You also wrote about teachers getting a vaccine, or some teachers getting a vaccine soon. Tell us a little bit about that and what people can expect. So
teachers are one of those essential worker groups in phase 1B there are the first 4 events this week scheduled to vaccinate teachers today, tomorrow, Saturday, and Sunday. 3 will be held at schools. 1 is in a vacant building, I'm told. And about 1,000 teachers and school staff will be vaccinated there. They have their own appointment system. So again, a separate system from the one that 65 and older adults are supposed to use. This system is just for teachers. Similar though, you input all of your information, put on a waiting list, and then they will contact you with an appointment to get the vaccine. Again, it's likely first doses at this point just for teachers. The Department of Education spokesperson told me that they will be scheduling second doses at these events. We'll see what comes of those. Today, again, is the first event. But teachers, and Natalia Alamdari, our education reporter, has reported a lot about how a lot of teachers don't want to be in the classroom until they're vaccinated and or there's protection for their students. So this is a big step for the state. But again, very limited supply. So it's going to take a while to get through all of the teachers. About 13,000 teachers on the first day the registration system was open, which was Tuesday, signed up. So less than 10% of those are going to get a first dose this weekend.
And just as we wrap up here, looking ahead, I'm curious what storylines you're focusing on, what aspects you hope to dig into more or report about more.
Well, one of the things that we definitely have to track is how does this change with the Biden administration now in charge of vaccine distribution? They made a lot of policy announcements this week, including ramping up the minimum shipments to states by about 16%. It's difficult to say how many more doses that will translate into here in Delaware because it's been uneven week to week. And because we're such a small state, getting or not getting one shipment can really change those numbers. So I don't want to say how many more doses that will result in, but more is the promise. And the Biden administration has said that will remain steady for at least 3 weeks. And that's been one of the main criticisms from health policy experts and state officials, not necessarily here in Delaware, but state officials in other states have been vocal about the lack of federal support and guidance in the early stages of the vaccine rollout. The Biden administration also has promised to purchase 200 million more doses from Moderna and Pfizer, regardless of if a third or fourth vaccine maker receives approval. So that could drastically change how much supply there is. And then the challenge would just be, can you get that supply into people's arms? Right now, the greatest limiting factor in all of these events and in all of this planning is simply there's not enough vaccine for the number of people who want it. You can argue whether the prioritization should work as it does. You can argue whether you should open up to phase 1B before all of phase 1A is over. But in all of those scenarios, there's not enough supply. So we'll see if that changes with the Biden administration now in charge.
Well, Brandon, thank you so much for your reporting. Seriously, it's been, I think, a godsend for a lot of people. Just to re-up that, one of the avenues of finding more information about how to get a vaccine is vaccinerequest.delaware.gov. Again, that is vaccinerequest.delaware.gov. Again, like we mentioned in the beginning, consult the state's website, consult your doctor or healthcare practitioner, consult Delaware Online for any more questions. And please subscribe. This is important work that Brandon and Izzy and Jeff and so many other reporters are doing. And your investments help us continue to ask the hard questions that Brandon is asking of these state officials. So thank you so much for watching. I'm sure we'll be back here with you soon, and have a good rest of your day.